So thank you so much for sitting with us.
My pleasure entirely.
So, Dr. Dhall, in your practice, how are women different than men?
Oh my God, that's a difficult question. Women are definitely more complicated than men. Sorry. I don't want to go there, but yes, in cardiac practice, women in reproductive age group are by and large, to some extent, protected from heart disease. Of course, this protection, like I have said earlier, is lost if there are co-risk factors, like if a person is hypertensive, diabetic, has high cholesterol, has very strong family history, takes oral contraception. These protection is lost, and again after menopause, the risk of heart disease among men and women, they kind of become the same. So it is actually a little bit of a myth that women are free from heart disease. It is just that we understand that the risk is a little lower than men, but at the same time, please don't forget that heart disease still remains the number one cause of death even among women, much more than breast cancer, cervical cancer, and so on and so forth. So we should not disrespect heart disease in women. There is a problem here. Problem is that in all clinical trials all over the world, there is a very poor representation of women in any of those clinical studies. Secondly, women are deprived of appropriate timely care for heart disease in most geographies of the world, more so in our country. This could also emanate from the fact that the presentation of heart disease in women remains a little atypical. They are not as classic a presentation as with men. The symptoms are usually a little atypical. But we have to factor this when we see a female. If I get called to see a female who's diabetic, hypertensive, dyslipidemic with a strong family history, she is having chest pain, and she on an ECG I see ST elevation, I'm not going to say she's not having a heart attack just because she's a woman. I'm sorry. We have to respect symptoms of heart disease in women. We have to realize that they could be a little atypical, but we have to give them benefit of doubt.
So basically, these days there has been this news that's floating around across the channel that so it was a blog written by a woman that symptoms of heart attacks are different in women than they are in men.
So the classic crushing chest pain in the front of the chest, the classic presentation which exertional symptom of heart disease may not happen in them. So I told you earlier, we have to look for more atypical presentations. Common diseases tend to have some uncommon manifestation. Diseases don't read a book when they come to you. So there are more uncommon presentations or atypical presentations when women present. Somebody may present with shortness of breath, somebody may present with jaw pain, somebody may present with neck pain, somebody may present with abdominal pain. So these are things which we have to keep in mind and factor when we deal with the women, especially if they have additional risk enhancers like I discussed.
Being a female, क्या उनको heart attack के chances कम हैं?
जितनी heart disease reproductive age group में थोड़ी सी benefit होती है महिलाओं को, वो नहीं होती अगर risk enhancers होते हैं, और menopause के बाद वो जितनी मर्दों में होती है उतनी सामान्य हो जाती है. परंतु हार्ट डिजीज की मैनिफेस्टेशंस एटिपिकल होती हैं विमेन में, और इस बात को हम भुला नहीं सकते.
So, are there any heart diseases that are peculiar in women than apart?
Oh, I think it's a good question. I will like to answer this in two ways. One are conditions which happen in men but possibly happen more often in women. And these are conditions like there is a disease, we refer to it as syndrome X, which is actually microvascular angina. You know, when we look at coronary artery disease, we only look at the coronary arteries, which of the major arteries which sit like a crown on the heart. That's why they're called coronary, by the way. So we only look at these. We do not realize that there is going to be, the blood flow is also controlled by what is happening at the microvascular level. So women do have a condition which is called microvascular angina, where the presentation is of typical chest pain. You can have other features also, but when you do an angiogram, it is absolutely normal. So this is syndrome X, microvascular angina. It's very difficult to treat, and it happens more often in women than in men. Then there is a condition called stress cardiomyopathy. It's got a very interesting name. It's called Takotsubo cardiomyopathy or broken heart syndrome. Takotsubo is an octopus trap in Japan, and the heart is, the apex of the heart balloons, and it can happen with any strong emotion, and women suffer from this more than men. This is, I would put it, normally, but there are 2-3 conditions which are peculiar when women get pregnant, and they are, for example, you can have a spontaneous coronary artery dissection, which is a condition causing a heart attack in women during their pregnancy without any atherosclerotic coronary blockages. So the inner lining of the arteries of the heart just dissect, and they can cause a heart attack. So these need to be recognized, and the entity needs to be recognized. Secondly, towards the end of pregnancy and the early postpartum period, people can get heart failure, a condition which is not uncommon in India. It is called peripartal cardiomyopathy. And this condition also should be recognized that it has a relationship to heart disease, especially among women. Some conditions worsen during pregnancy. So we try and avoid pregnancy in patients who've got severe pulmonary arterial hypertension, Eisenmenger syndrome, or coarctation of aorta, and so on and so forth. So this is how I would say that there are some conditions which are more common in women than they are in men. So I will again repeat my phrase, सही आहार, सही विचार, सही व्यवहार और समय अनुसार उचित उपचार, तो शायद नहीं पड़ेंगे आपके पास. Thank you.